Hi, my name is Dr. Erasha.
And I'm Dr. Tesh.
And we wanted to say a few words about high blood pressure today. So the first thing I wanted to start with is bust a few myths about high blood pressure, because I think probably the first thing that people expect is if their blood pressure is high that they're going to feel unwell. And that is just not true, generally. So your blood pressure has to be really, really high before you're going to get symptoms.
Like sky high.
Yeah.
So I've had a few people this week, they had been told their blood pressure was high for years and years and years. And each time they were like, nah, I feel all right.
Yeah.
But then, it came to our consultation and I was like, oh, it's really reached a peak now. Now I've got them on medication, which is good.
Yeah.
And it's something they really didn't want to address just because they weren't having symptoms.
Myth number 2, unfortunately, is that actually if you're a really super healthy person, you could still develop high blood pressure. So actually the myth is...
What?
The myth is if you're healthy that you can't get high blood pressure. Because unfortunately that is just not how it works. There are loads of different risk factors that can play into why you might get high blood pressure, and certainly things like smoking or carrying a bit too much weight or not exercising enough are some of them. Unfortunately, some genetics comes into it too, so even if you're doing everything that you can possibly think of, it is still possible to get high blood pressure.
There's a third myth.
Is there a third myth?
That you should check your blood pressure every day.
This myth. Okay. So
Myth number 3.
Myth number 3 is...
This is a biggie one.
Is a big one.
Stresses people out.
Super stresses everyone out, because
Stresses
actually
people
once
out.
you've got a diagnosis of high blood pressure, or even if you don't for some people, if you started to get a little bit used to just measuring your blood pressure here and there, and then it escalates into, okay, I'll just do it every day. The reason that this is not a good idea is because your blood pressure naturally changes from moment to moment. That is normal. So you're going to find, if you're checking your blood pressure 5 or 6 times a day, that it will be up, down, middle, all
Left,
over the
right,
place.
round and
Forwards,
round.
backwards, all over the shop. So it isn't actually very useful for you. And actually, if you then find that it goes up and you check it again, you'll be anxious about it. You'll be naturally worried. My blood pressure is high, and then your blood pressure gets even higher.
Yeah.
And that isn't a true reflection of what's happening with your blood pressure generally and what's happening with your health. And there is one other thing I want to mention, and it's not a myth, actually. It's to do with...
Is this a truth?
It's a truth. It's a truth.
It's a truth.
It's a not very well-known truth, I think, personally, because actually when I talk to people who have high blood pressure, I talk to them about salt pretty much all the time. And for a lot of people, it comes as a shock. How does salt affect my blood pressure? It does. Unfortunately, salt intake is a big risk factor for high blood pressure. And the problem is that a lot of us in current modern society rely on fast food or ready meals. And this stuff is full of salt, people.
Yeah.
Full of it.
And also certain cuisines as well. So Caribbean cuisine and Indian foods can often contain so much salt.
Yeah. And it's easy to get carried away with putting salt into your meals, not considering what was already in there in the first place. And then before you know it, you've smashed through your daily salt allowance really easily. Yeah. So it's one thing that I would say just to maybe keep an eye on that could make a huge difference to your blood pressure without even thinking about medicines or the harder stuff like weight loss and exercise.
Yeah, modifying salt in the diet.
Yes.
Yeah. I've seen people rolling joints of meat in salt, and I was like,
that's probably not a good plan. No.
If you've enjoyed this, then share it using the link below and subscribe to the YouTube and Facebook. A GP helps. Bye.
Bye.